Hi guys, so this is Dr. Khan from Your Family Doctor, and today I'll be discussing a report which was published recently in a medical journal called The Lancet, which states that by modifying 12 risk factors might help to prevent or delay up to 40% of dementias. So first of all, for those guys who do not know what dementia is, I will give you a very brief summary of what dementia is and what it can lead to. Okay, so let's get straight to it. Okay guys, so very quickly, for those that are new to my channel, please consider subscribing and hitting the bell button so that I can continue to bring you valuable medical content to your doorstep. So let's get straight to what I'm covering today. Okay, so what is dementia? Dementia describes a group of symptoms affecting thinking, memory, social abilities that are severe enough to interfere with your daily life. Dementia is not one specific disease, but it may be due to a number of diseases leading to dementia. Although memory loss is commonly associated with dementia, memory loss alone does not mean that you have dementia, and there are many other causes for memory loss. And maybe this is a topic that we can discuss in a different video. Alzheimer's disease is the most common cause of a progressive dementia, particularly in older adults. Although, as I mentioned before, there are a number of other causes that can lead to dementia. In terms of the symptoms that a patient with dementia may present with, there's many symptoms. The ones that I mentioned today include memory loss, confusion, difficulty in finding words or being able to communicate, as well as episodes of anxiety and depression. Now, this is not an exhaustive or complete list, and if you are interested in the other many symptoms of dementia, which are quite varied, then you can look at the YouTube description below, which gives you links to websites where you can find more information on dementia and any other diseases. So why does dementia happen? What's the pathological process behind it? So essentially, and to put it simply, it's due to a loss of or damage to the nerve cells and the connections in the brain. And depending on which part of the brain is affected, dementia will affect people differently, causing different symptoms. So the report that I'll be discussing today was published by The Lancet, which is a general medical journal, and it's also one of the oldest and best known medical journals in the world. So the information that I'm bringing you today is from a highly reputable source, and it doesn't get any better than this. And in actual fact, that the report that I'll be discussing with you today has been of some recent discussion in some newspapers. So just to give you guys a very brief summary of and a background of the report that I'm presenting today, it was titled Dementia Prevention, Intervention and Care, the 2020 report of the Lancet Commission, and it was published on the 30th of July 2020. The report involved a follow-on from the 2017 Lancet Commission on Dementia Prevention, Intervention and Care, which identified 9 potential risk factors that could be changed to prevent or delay dementia. Today I will be discussing the new 2020 report, which has identified through a series of new reviews and meta-analysis 3 more modifiable risk factors. I'll be discussing the 9 risk factors from the last report first, including the 3 new risk factors from the new report of this year. And for those that do not know what a meta-analysis is, just very quickly, it's a statistical analysis that combines the results of multiple scientific studies. They can be performed when there are multiple scientific studies addressing the same question. So now let's get to the discussion of the main topic of today, which is 12 modifiable risk factors. So the first risk factor is education level, and high levels of education in childhood, as well as continuing to learn and grow throughout your adulthood life, was associated with reduced levels of dementia. Benefits in overall cognitive ability were particularly seen in those before the age of 20. The second risk factor was hearing impairment, and interestingly, it was found that there was an increased risk of dementia in those with hearing loss, probably as a result of reduced cognitive stimulation. In another study involving individuals from the US around the age of 60, it was shown that there was a reduction in cognitive abilities with every 10 decibel reduction in hearing. Interestingly, in another smaller study, in those patients with midlife hearing loss, they were shown to have a steeper loss of volume of the temporal lobe part of the brain, which is this part of the brain as shown in this image. Interestingly, the use of hearing aids seemed to be a protective factor, and in one study it was found that hearing loss was associated with worse cognition in those not using hearing aids. Now going into the third risk factor that may lead to dementia, and this was high blood pressure or hypertension. And it was found that in those patients who had high blood pressure, they had a high risk of developing dementia in later life. This risk was further increased if the high blood pressure persisted into later life. One study found that high blood pressure caused a reduction in brain volume. High blood pressure is a common condition in which long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease, and in this case an increased risk of dementia as well. The aim should be to maintain a systolic blood pressure of 130 millimeters of mercury or less in midlife from around the age of 40. And interestingly, antihypertensive treatment or medication for blood pressure was shown to be effective in reducing the risk of dementia. So now going into the fourth risk factor, which was physical inactivity and exercise. And it was shown that there was a reduced risk of dementia in those who exercised, particularly in those patients who regularly did aerobic exercise. In another study, it was shown that those patients who did at least a weekly moderate to vigorous physical activity, and this was defined as breaking into a sweat, then they were associated with having a reduced incidence of dementia over a 25-year period follow-up. In terms of the risk factor number 5, this was diabetes. And in one meta-analysis, it was found that patients with type 2 diabetes were associated with having an increased risk of any type of dementia. And this risk of dementia was increased with the duration and how severe the diabetes was. For those who do not know what diabetes is, it's a condition where the body does not produce or release enough of a hormone called insulin, which normally keeps the sugar levels or the glucose levels in the blood at a set level. So if there is not enough insulin, the sugar levels inside the blood will remain high. The sixth risk factor was weight control and obesity. And it was found that there was an increased risk of dementia with an increasing body mass index, especially for those patients who were already obese. In another study, it was found that a weight loss of 2 kilograms or more in people with a BMI of more than 25 was associated with a significant improvement in attention and memory. Now going into the 7th risk factor, which was smoking, and it was found that in patients who were smokers, they had a high risk of dementia compared to those who did not smoke. And interestingly, even if you were a smoker for a long time, if you stop smoking later on in life, then this reduces your risk of dementia. The other interesting point to note here is that those patients that were involved in second-hand exposure to smoke, which is passive smoking, there was a more deterioration in their memory. In terms of the 8th risk factor, which we'll discuss today, which is depression, it was shown that there was a high risk of dementia in those patients that had episodes of depression in their life. And interestingly, those patients that were on antidepressants or medications to help them with their depression, there was a delayed progression to clinically diagnosed Alzheimer's disease. Now the 9th risk factor, which is social contact. Social contact, which is now an accepted protective factor, enhances cognitive reserve, and several studies have suggested that less social contact increases the risk of dementia. In another study, the dementia risk was increased in those who were single or widowed compared to married people. And in another UK study, a lower risk of dementia was found in those over the age of 60 who engaged in more frequent social contact. So now we are going into the 3 new modifiable risk factors from the 2020 report. And these include, so the first is air pollutants. And in some animal studies, it was shown that airborne pollution accelerated the neurodegenerative process, which was the loss of nerve cells and the connections in the brain, which actually increased the risk of dementia. In addition to this, they also increased the deposition of protein on the brain, which is also involved in the pathological process leading up to dementia. In particular, high concentrations of nitrogen dioxide and fine ambient particulate matter from traffic exhaust or residential wood burning was associated with an increased risk of dementia. The other risk factor is excessive alcohol consumption. One French study looking at over 31 million people admitted into hospital and were found to have excessive alcohol consumption, they were associated with an increased risk of dementia. In another study, it was shown that those patients that consumed less than 21 units of alcohol per week had a reduced risk of developing dementia. Now going into the 12th risk factor, which was head injury or traumatic brain injury. Here, mild traumatic brain injury was any head injury that caused a concussion, and a severe traumatic brain injury was defined as a fracture of the skull, brain injury, bleed or swelling. Some of the causes of traumatic brain injuries include falls, car or motorcycle or bicycle injuries, boxing and other recreational sports. In one cohort study of adults who had suffered with concussion, it was found that the risk of dementia doubled. In another study looking at sports head injuries, it was found that former Scottish players were more likely to have Alzheimer's disease, which accounts for 60 to 80% of cases of dementia. Okay guys, so those were the 12 modifiable risk factors if we change throughout our lives, then this can help to save us from more significant medical problems later on in life. And it's also important to note that these risk factors not only reduce the risk of dementia, they also help to reduce the risk of other health related problems. In the YouTube description below, you'll also find some information on 3 additional risk factors, as well as a link to the report that I've used today, as well as some other links which you may find useful. Finally, if you are new to this channel, then please consider subscribing and hitting the bell button so that I can continue to bring you valuable medical content to your doorstep. Thank you.